Venofer Vial is a medication used to treat anemia in people with long-term kidney disease. This is because individuals undergoing kidney dialysis may experience blood loss, and those using the drug erythropoietin may need additional iron to help make new red blood cells. Iron is essential for the production of red blood cells and the transportation of oxygen in the body. Due to the inability of many kidney disease patients to obtain enough iron from food, injections of Venofer Vial may be necessary to meet their iron needs. It is important to consult with a healthcare professional to determine the appropriate dosage and timing for taking this medication. When using Venofer Vial, it is typically administered through an injection into a vein, either slowly over 2 to 5 minutes or mixed with a saline solution and given over a longer period. The dosage and duration of the treatment will be determined by your medical condition, age, lab results, and how you respond to the treatment. There is a small chance of experiencing a serious allergic reaction to iron sucrose. To minimize this risk, it's important to be closely monitored during and at least 30 minutes after your treatment. If you do have a serious reaction, your treatment may need to be stopped. Seek medical assistance immediately if you experience swelling of the face, tongue, or throat, difficulty breathing, rash, or hives. If you are self-administering this medication at home, it's important to fully understand the preparation and usage instructions provided by your healthcare professional. Before using Venofer Vial, always visually check for any particles or discoloration in the liquid. If you notice either of these, do not use the medication. Make sure to also learn how to properly store and dispose of the medical supplies. Some common side effects of Venofer Vial may include muscle cramps, nausea, vomiting, strange taste in the mouth, diarrhea, constipation, headache, cough, back pain, joint pain, dizziness, or swelling of the arms/legs. You may also experience pain, swelling, or redness at the injection site. If any of these effects continue or worsen, it's important to inform your doctor. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. In some cases, severe dizziness or fainting, hypotension, may occur while receiving 4 iron. This may be helped by giving the medication more slowly or at a lower dose. It's important to follow your doctor's directions carefully. If you experience any serious side effects such as abdominal pain, chest pain, irregular heartbeat, arrhythmias, pressure in the chest, severe headache and blurred vision, hypertension, or problems with your dialysis access site, it's important to inform your doctor right away. While a very serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. Before starting iron sucrose, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Additionally, it's important to inform your doctor or pharmacist about your medical history before using this medication. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to use this medication only when clearly needed and to discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding, as it can pass into breast milk. When taking Venofer Vial, it is important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It is recommended to keep a list of all products being used, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is important to always consult with a doctor before starting, stopping, or changing the dosage of any medications. This will help ensure the safe and effective use of Venofer Vial. If someone has taken too much Venofer Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It is important to have lab and/or medical tests such as complete blood count, ferritin, transferrin, total iron binding capacity (TIBC) while using Venofer Vial. Make sure to keep all medical and lab appointments and consult your doctor for more details. It's best to get your vitamins and minerals from food whenever possible and maintain a well-balanced diet. Foods rich in iron include meats, especially liver, eggs, raisins, figs, broccoli, Brussels sprouts, beans, lentils, and iron-fortified or enriched cereals. Remember to follow any dietary guidelines as directed by your doctor. Remember, it's important to take each dose of Venofer Vial as prescribed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to establish a new dosing schedule. It's crucial not to take a double dose to make up for a missed one. As always, follow your healthcare provider's instructions closely for the best results. Be sure to consult the product instructions and your pharmacist for storage details. It's important to keep all medications away from children and pets. And remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. When this product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.